What I'm showing now is a Volar approach and the beginning of how we put the plate in. After that, we turn around and Dean will show the dorsal approach. And after that, or maybe a little later on, Johannes will show a more minimal invasive technique. First, I start finding the proximal pole of scaphoid proximally. The thing is just to not have a straight incision over this area, just to avoid scar tissue. And probably it doesn't matter, but that's the way I'm used to do it, at least. Then I go to the flexor carpi radialis tendon, and I decide my incision to be something like that. And now is a thing you have, or none of you have ever seen before. We are opening the skin, and it's very interesting. And I always use self-retractors, and I prefer that they are professors, so I'm very happy today.
Give another forceps.
Okay. Yep. Opening up. Here's that's the flexor tendon. It's down here. Finding the flexor tendon like this.
CR. Flexor carpi radialis.
Yeah, flexor carpi radialis, of course. And when I go distally over here, I used to be a little careful. There is a branch from the radial artery running in this area, so I tried to avoid it. And here I think it is. Here is the branch, I think. Okay. Getting under that artery. Here you can see it. See? Now we know where this is, and we just open the tendon sheet in both directions. So, getting it a little to the ulna and making a small incision in the tendon floor.
Do you find the artery?
No, I never routinely find the artery. Like this. Yep. And we just open and go more distantly than you think you need to, because you will appreciate in the next session. So, not yet. I use my finger just to get rid of the soft tissue. And now, this is one of my trick, kind of. Now I use a Hohmann retractor, and I go distally to the distal radius, between radius and in the ulnar area, and I, here, put it down. Now I use that swab and taking all the fat tissue away. Now you can see this is the pronator muscle here, and this is the tendon part, and this is the joint line here. So I want to make my incision in this area. Then you have some tendon still. Now I go radially, just on top of that. And now you can appreciate to see all that tendon area of the. Are you able to see it? There, here is the stop of the muscle fibers. Here you can see the muscle tendons. See? And this is the tendon part, and here is the joint. So now we just detach the this part of pronator like this. And then we put maybe like that. Okay? I will show you. Now I use the knife just to detach this area which have the tendon part of pronator. Now you see, you can put it. It's a strong ligament, and you can put it back. You see, and that's possible to put over the plate to kind of protect your tendons. So we now, if you hold this one, and we take the Homan retractor and put it over here. Now we have a very good vision of the distal radius. You can see the ulnar corner perfect over here, and you can also see where the ulnar corner stops. That's a little trick. If you find the corner of distal radius, the corner between the carpus and the sigmoid notch, you may put a K-wire down just like that. Then you know your ulnar, you should never put your plate more ulnar than that. So it may help you just to guide you to put the plate in the right position. So now we kind of pretend like we have reduced the fracture very well, and I want a template to decide whether I use a large or a wide or standard plate. No, we would probably, I always do honestly, we go to brachioradialis and just follow the bone, stitch to the bone all the way, and then you will, here it starts, and the footprint is a lot bigger than you may think.
I just felt it go.
Yeah, here you see the tendon from the thumb. Anyone want to just see what we're doing, because it don't make any sense just talking about what we're doing and no one see anything. Just get around. Here is the adductor, and here we have detached the brachioradialis.
The subperiosteally, he elevated the first dorsal compartment and he released the brachioradial.
Yeah.
You see the whole side of the.
Yeah. Okay, now we have this area which is called the radial ridge. So when we put the plate in, we want it to go all the way over to ulnarly, because that's the most important part to repair. The ulnar corner is the important part. So now we put a template in, and we look whether it will cover it covers very nicely to the ulnar part, but it's way too narrow, you see. We want the plate to go all the way out here. So this is too narrow. We put in the wide template, and we see we still cover the ulnar corner, and it stops with a radial ridge. So it's a wide one we want.
Show them the watershed line.
The watershed line is, many people think the watershed line is where the muscle stops. That's not true. The watershed line is all the way up here, the highest point on radius. It starts going downwards before you go into the joint, so there is no danger of cutting here. Okay?
So as we said, we want to be proximal to the watershed line,
Yeah.
or to it with the plate,
Yeah.
not beyond it.
Never beyond. Okay, so we have decided we want the wide plate. Will you, someone unwrap it, please? Wide green or lime. Okay, that's our kit, and we start now taking out the plate, as of course is a wide one. Okay, we put the plate in. And here I think we are very close to where we want it, like that. Then we take one of the K-wires which are in here, and we put it into the distal ulnar hole. Okay, I think we are very close to where we want to be. Oh. Yeah. So we have one in, and we now align the plate, as you know. So it's aligned to the shaft, and we put another K-wire in. After that, we just start putting screws in, and that's no point for you to see how to put in screws. So I think we better go for a dorsal approach now.
The other option that you have is if you don't want to use the K-wires first, you can use the oblong hole.
Yeah.
Put a screw into the oblong hole and slide the plate up and down. I mean, some people like to use K-wires, some people would rather just go right to the oblong hole and slide the screw.
There is no
slide
more
the plate
electricity in
possibly
here.
Distal, whatever technique you like.
Yes, so that's, and just to, maybe I will take this off, just to show how nice you can put the pronator back over the plate after you have fixed it. Just keep this one. Here is the plate, and here is the pronator, and you just put it over again. This is maybe the beautiest part of the operation. So you see, here is the pronator, plate is placed, and you can push it all the way over and close down. Isn't it lovely?